Anthony Chadwick, the Webinar Vet, welcoming you to another episode of VETchat. I'm really pleased today to be carrying on a conversation we started a little bit ago as a second podcast with John Hemingway and Will Allman, we're going to be speaking all around sheep health, worming, what we should be doing as temperatures rise, as worms that were perhaps not as common are becoming more and more common. So first of all, welcome to you both. Thanks to Elanco for making this possible. Starting with you, Will, perhaps tell us a little bit about yourself to the listeners.
Hi, I'm Will, Director at Belmont Farm and Equine Vets in Herefordshire. Started life in a mixed practice in Yorkshire and then moved to sunny and very dry Herefordshire, where my main focus is on sheep and beef.
Thanks, Will. And over to you, John.
So I'm John Hemingway. I graduated in 2012, and then I worked for 4 years down in Salisbury playing on sheep and beef there. And then I've moved up now closer to home in 2016 to Shropshire, where we're dairy as well as sheep and beef. But I'm dealing with, almost all of the sheep for the practice, really.
Fantastic. And yeah, we were obviously talking about Haemonchus with two vets from up north in the northeast, talking about Haemonchus as very much an emerging problem. I think it's a different kettle of fish as you move further south. What's been your experience, John, with, as I've said, a worm that we talked about when I was at university a long, long time ago, but wasn't really a problem. So how are you sort of perceiving it now in 2025?
Yeah, so I mean, it's always been around and about, I think, going back historically, certainly through my 12 or 13 years, is that we've seen isolated cases, often in adult ewes rather than lambs that have been caught out, but they were particular farms with isolated cases. And then I think 2 years ago, last year, I suppose, is the year that it became more a mainstream problem. Where we are in Shropshire, we had 2 mild winters in a row where we hadn't really had even sort of frosty weather, really. Haemonchus eggs have very poor survivability in cold weather. So, if you get a cold winter, as we traditionally would have done in the UK, that thins out a lot of the pasture contamination. I think we hadn't had that for 2 winters. And then we came to last year, and I mean, it emerged, I think, in a lot of the country at a similar time. And I was seeing on, WhatsApp groups and stuff, people saying, "Oh, we're seeing all this Haemonchus," and I was thinking, well, I haven't seen it here yet, And then all of a sudden, the phone started ringing, and oh yeah, okay, we've got dead lambs, and you come and open them up, and it's very obvious it's Haemonchus. So I think it has come about as a result of those mild winters and generally, warming climate. Last winter, then we did have a good cold snap, and I thought to myself, oh well, that'll be reset now. We'll go back to how we were previously. And yet this year we do still seem to be having a higher than normal number of cases. Whether that's partially because after last year more people are aware and are looking for it, and are reporting it, doubtless that's got a part to play in it. But I think there's no question that this is something that has become a bigger issue over the last few years and probably will continue to do so.
What about your experience, Will? You're a little bit further south in Hereford. Have you been seeing it perhaps for a little bit longer than perhaps John's been talking about?
Possibly a little bit longer, but I'd say very, very similar picture to what John's saying. I've got a lovely video of a post-mortem with Haemonchus that I quite often show people to show, how numerous they can be, and that's dated 2018. So obviously we've been dealing with it for 7 years now.
Yeah.
But yes, what the sudden worry was a spike in cases, and it seemed to be very centered around a certain time frame, where you would have one case and then you would hear someone in your practice had a similar case, and that's where we're starting to go, okay, this is something we need to really focus on. And now we're seeing it almost throughout the year. We've had cases in May this year, whether they're hanger-oners from last year, but we're seeing cases all the way through. And the awareness and the understanding from farmers is they are, the worry is they're going to start panicking. And we have people ring us up going, I've heard my neighbour had that, I heard so-and-so had that. And it's good that there's understanding and they're aware of it. It just needs to control a narrative and give the correct advice.
I suppose there's a danger with that sort of panic to immediately say, well, I'm going to worm all of my sheep, in the farm next door to the one that's got it. And maybe that isn't necessarily the best answer. I mean, maybe we'll start. Tell us a little bit about how you deal. Well, I suppose first of all, diagnosis. Obviously, if we wait till there's dead lambs, it's a bit late in the day. Although I suppose it acts as an early warning signal for more problems. But how do you diagnose affected animals, and how do you decide, when and how to treat?
I think, to be honest, most of them are still giving us a call almost too late. And we'll get a phone call saying it usually is used to begin with. However, we're seeing it lambs because we aren't worming as much because we're dry. They will be dead ewes to begin with. Or I've got a couple with bottle jaw, and then usually the classic be, I fluked them, because that's the understanding is bottle jaw is fluke. And then it's that phone call conversation about, well, let's get these in. Let's start with a fecal egg count would be a sensible place to start. A visit would be ideal that we can actually have a look at these animals. And then when we're talking to them, we're looking at signs of anemia. So we're getting to check colour. But realistically, we're wanting a fecal egg count to at least understand and confirm that Haemonchus is present. Where we go from there depends on severity, depends on where further testing we do, such as the peanut agglutination, to see what levels we're at. But I'd say the first thing we get is a phone call ring us up still saying, I've got too many dead ewes or I've got bottle jaw, is usually the first point of call we get.
John, obviously, I know we have these scorecards that kind of help us with measuring anemia. So is that a useful tool for the farmers, or do you tend to use that more to help you with your diagnosis when you've got maybe ewes that are hanging back, look a bit sluggish, etc.?
Yeah, they are a useful tool. But if I could first just pick up briefly on something that Will said, which was people aren't worming the lambs as much because it's a dry year, and I think that's actually a big part of the problem, because Haemonchus doesn't typically cause scouring. It's a blood-sucking worm. The lambs don't have diarrhea. This year, because it is so incredibly dry, the levels of a lot of worms very low anyway. There isn't the humidity on the ground, and so there are more people not worming and being perhaps more complacent about worms are not a big deal this year, and then they get snuck up on by Haemonchus, which hasn't caused the typical symptoms. Where in a previous year, Haemonchus might have been there, but the fact that they are, treating for Trichostrongylus and, the other worms anyway with the scouring means that Haemonchus has been kept in check a little bit, inadvertently. So I think we've got that working against us this year as well, and it's worth noting that. In terms of the scorecards, which I've got one here purely by coincidence. Yeah, they are very useful as a reference tool for farmers to treat selectively based on the level of anemia in the flock as they go through. But I think that is something that you get farmers used to and using as a sort of monitoring tool as the year goes through, rather than something that you use in the heat of an outbreak. When you've got dead lambs, it's good in the respect that you can make a definitive diagnosis there and then, because you cut into the lamb and it's white, and then you open its abomasum and it's full of worms. But you've got to remember, those lambs have died because they've run out of blood, or because they're so anemic that they've succumbed to the mildest other illness. There will be lots that are not dead that have almost run out of blood, and in that setting, you can treat the ones that are anemic. You can't produce a load more blood overnight, so those lambs are not going to just bounce back off the back of, they were anemic, we treated them, now they're going to be better. Making blood is a slow process. So yes, they are excellent, but as a monitoring tool. In terms of actual treatment during an outbreak, you have to jump in if you've got dying lambs, you're going to jump in and use a wormer that is highly efficacious, and just clear things out and know where you are to begin with. After which you can begin to put in place a protocol. And yes, there are now some of the in-house machines that are offering speciation for Haemonchus eggs when you're doing egg counts, which is excellent. But Haemonchus are very, very prolific egg layers. So if you have a high Haemonchus burden, if you're just doing your normal routine worm egg counts every 3 or 4 weeks, you're going to pick up a high egg count before things start dying. It doesn't matter whether you're differentiating Haemonchus or not. So, if you're getting caught out by this, really it's because you're not doing egg counts frequently enough anyway. I suppose ewes would be the exception to that, where you're perhaps not doing routine egg counts, but they don't necessarily have complete immunity against Haemonchus like they might against, Tristrongylus and Telador sage or whatever.
Say off the back of, like, say, these in-house tests and the peanut agglutination, I feel where the benefit of actually speciating it is to identify what treatments can be given. Where we've had issues before is we've had a high count, and as we do, no scour high count 1-1 usually equals Haemonchus. But when we sent off a peanut agglutination, we're talking 70% Haemonchus, so we're actually still talking 30% Strongyard. So if we go in with a Closantal narrow spectrum, actually, are we missing a large portion of worms that we aren't treating?
Yeah.
So it's a double-edged sword. It's great. Knowledge is always better, but it still needs a complete overview of how we're doing things.
I suppose, I haven't seen this written down, but I suppose in that situation, the sum would be, if your egg count was 1,000 and it was 70% Haemonchus, you're going to say, well, would I treat a 300 eggs per gram lamb in any circumstance? And if you wouldn't, then use your narrow spectrum, I guess, and leave the 300.
Unfortunately, it was a count of about 15,000 or something.
Yeah,
this is where
easy maths.
It's a difficult. There isn't a one size fits all. There isn't this is what you should do. This is what you should do. Every case is different.
This is all judgment, isn't it? It's veterinary judgment. It's seeing the whole farm. It's being aware of what the issues are, how widespread it is. If it's 1 or 2 sheep, lambs, ewes or lambs, it's different than if there's 20, percent of the flock that's affected. So the preventative side is really important. So obviously vets should be advising farmers to be taking egg samples on a regular basis. Is that, what sort of period of time is that, from the spring to the autumn, or when should you be starting and stopping? Are those fecal samples sent into the vets and then sampled obviously by the vets or the laboratories? Is that kind of how it's working at the moment?
I think I got what John said with the lambs. We are looking at doing it 3-4 weekly after our white drench off the back of Scots or Naddis parasite forecast. The feasibility of doing that on the ewes, that's where probably there's a stumbling block for the farmers.
Yeah.
And I'd almost say it's by surmising some of this Haemonchus, I feel, has come back after actually our real good work of people worming ewes less. We've for years have been trying to get people to worm ewes less for worm control, which then people are just looking for signs of scour. So then it comes that difficulty of how do you diagnose it in the ewes if people aren't willing to do fecal egg counts?
Yeah, and they're not scouring as much.
No, it's quite easy to see scouring ewes or lambs. It gives you an indication, something quite easy to get hold of, and then it's a muck sample brought in.
And on top of that, we've been saying to people, a high egg count in a ewe is not necessarily indicative of an issue, because there could just be natural resilience there. Treat selectively and use, base your decision as much on clinical signs as the egg count. So the traditional advice on ewes has not helped the Haemonchus situation. But I think as Kaz said in a recent podcast, this idea that ewes don't generate natural resistance to Haemonchus is not necessarily true. It's a case of exposure, and ewes get caught out with it if they haven't seen it. The same as you occasionally get older lambs that get caught out with coxy if they've somehow never encountered it as a younger lamb. Older ewes, they get caught out with Haemonchus because they've not seen it before. But I think, if there has been exposure, and it becomes more of a commonplace parasite in the UK, well, actually, it might be the case that ewes do come to have a greater natural resistance to it. I mean, speculation, but
But it would seem a sensible thing that if they've never come across it before, they're going to be much more prone to it than if it's around all the time.
If they're naive, and that's what we're seeing at the moment. We are seeing naive farms coming across it.
Yes.
The farms we've had for a good couple of years that have got established Haemonchus, they are a lot quicker at spotting signs. They're a lot quicker at not waiting for the deaths, the bottle jaws. They're a lot quicker at going, that 2-year-old's last in the group. Why is that last? That shouldn't be last. Right, let's get a hold of her, have a look at her.
Yeah.
And looking, like say, we've only just recently got the scorecards. We're asking, are they pale, are they pink? The more they see that's normal, the better it is to identify when it's abnormal. And if they're concerned, bring in a muck sample.
And very much what you're both doing at the moment sounds like you're worming off the back of anemia or high egg count. So you wouldn't necessarily worm the whole flock. You would worm the individuals that you thought were most affected. Or do you get to a point where you say, actually, we should just do the whole flock?
I think if you are, if you're using a Haemonchus chart, it allows you to treat the ones that are clinically affected. The Scots advice in most circumstances is always to leave some animals untreated if it's feasible. And certainly more and more as farms get better technology with whey crates and EIDs, using growth rate alongside fecal egg counts in your lambs is becoming more commonplace. And actually, you've got a high group fecal egg count, but the lambs are coming through. That one's still doing 300 grams a day. Well, doesn't need to see a wormer. That's fine. Yeah. So it is multifactorial, isn't it? A lot of 3 variables on that decision. You got your egg count, you got your weight gain, and then perhaps you've got your anemia score as well.
I think we will get pressure from farmers, especially if they have dying animals, to just worm the lot. They'll want to come and just say, I just want to worm everything. I just want peace of mind that everything's done, then I haven't missed any. And that, like say, with the high number, the high replication rate, the resistance chances greater, we need to really give them an understanding of it. And even if they are going to worm a high percentage, we want to at least get some they're not worming. And they're the ones that we need to check and make sure they're good color, good growth rate, or they're good body condition. Everything is in looking excellent, because I do see and I have heard multiple farmers worming everything off the back that they heard at the market that someone had one. So when we had that outbreak, when we had a large number of cases last year, I would dare hate to say how many farms probably wormed everything off the back of issues on another farm.
Yeah. And this is where, pharmaceutical stewardship is so important, because presumably at some point in the future, if everybody's worming everything, then you're going to start having more of a resistance issue, and then potentially a worse problem than we've got, at the moment.
Yeah. I mean, to be clear, Will, but you're talking about worming everything because of what happened to somebody else in that circuit. I mean, if somebody's got dying lambs in a group, I'm more than happy for let's sort this out, and then we will put our plan in place when we've got breathing space. Just to be clear on that, I suppose.
And what about the farmer that, because using that as an example, the farmer who says, I'm going to worm everything because, I might have a problem because his next door neighbor or a mile down the road has got a problem. I presume, whilst it sounds like it's inevitable that everybody will end up with Haemonchus, is there point in trying to quarantine and keep your land free of Haemonchus, or are you getting to the point now where you're saying that's not a sensible way of looking at things? So obviously, take worm eggs. If there's no sign of Haemonchus, then clearly there's no need to worm for it, is there?
Well, I mean, you should be quarantining anyway. I mean, Haemonchus is just one example of why you should, and you should be using a highly efficacious wormer and a scab treatment in almost every situation as part of your quarantine protocol. So it shouldn't really be a question. What we don't know, I think, is, I mean, I'm sure there is work on it, but going back historically, what would be a typical percentage of the of the worm burden on an average farm that is Haemonchus anyway? I'm sure awful lot of people have it there and have probably had it for some time at a low level, without it causing a problem, because it's kept in check by the worming they've done for, the parasites that we're more accustomed to, to working with. So, in terms of keeping it off your individual farm, you should be able to theoretically do that with quarantine. But do you actually know it's not already there?
So this is the point. Is it now so common that it's not? I mean, it's obviously worth quarantining for other reasons, as you've said, but we shouldn't be getting too wound up about Haemonchus if it's not causing a problem. But then, of course, we see these, outbreaks or increases in numbers.
There will be prevalence studies. I just haven't necessarily read them.
The point of the quarantine isn't just about stopping Haemonchus coming on; it's also stopping resistant Haemonchus coming on.
Yes,
Same what we're doing with the strong guards. It's why get to know what worm you've got, and this is know what worm you've got. Be happy with what your plan is to kill it, and this is what we're trying to do now with these established farms. We are sitting down and doing a worm plan. I don't like the word plan because it's hard to plan when everything changes. It's very weather dependent, field dependent. But we're sitting down, we're going through fields, we're giving them statuses, green, yellow, reds. We're understanding when they want to do fecal egg counts, when they want to do investigations. Really quite handy that we've got this funding available. We've done that off the back of this Animal Health and Welfare Pathway funding on the disease. We've utilised that for this reason, and it gives people confidence and peace of mind. So it will become far more of a strategy on each individual farm on what we do.
And that also has to help them save money if they're not worming unnecessarily, like that example we were talking about before as well.
And time, to be honest, time is more, I don't want to say it's more precious than money, but farmers are severely time poor.
Yeah.
If we can save them time by doing a fecal account before they need to get them in, and we don't need to worm, it's not just the cost of the wormer, it's the handling, the setup, the getting a neighbour in, because a lot of people are on their own. They need to get the neighbours in to help them. So it's all benefit if we find out the correct thing to do.
Fantastic. Any last sort of final thoughts or points either of you want to make? It obviously is becoming more of a problem. It's great that you've got such a good handle on it and a good way of also developing, I think, that vet farmer relationship as well, which is so important. And I know the health schemes, the government health schemes of these visits that you can go onto the farm and they're paid for. I think that's hopefully helping with that relationship as well, isn't it?
It is. Yeah. I mean, we talk about sheep farmer vet sort of contact and relationship again and again, don't we? And I mean, I think the farmer just find the vet at the practice that you click with and is your point of contact. Yeah. And I mean, just talk to them, and health plans are great, but I would, in a lot of the time, I would sooner just have somebody on the phone every other week saying, what's going on, what's happening at the moment, what are you concerned about, than have something written down and reviewed once or twice a year. So it's having that rapport. and just feeling like you can phone each other with no particular agenda other than to say, how are things, what's going on at the moment.
And I think, Will, you were saying plans, weather changes, different things happen. Plans very quickly are no longer appropriate because, as Eisenhower had said, you have to plan, but planning is useless because once the enemy comes into contact with you, things change.
Yeah, and it very similar to John. You want that relationship where someone rings you up or you drop in on them, and simple questions like, "How are your lambs going? You sold many?" "Oh no, I've sold less than I thought I would." That's a question. That's a point thing. The other thing really is, this is a worm. Let's not panic about it. One of my worries coming up, we've been so dry lately, I'm worried when it does rain. 4 years ago when we had this drought before, we had a huge, almost a second spring amount of worm burden rise because the rain came. So let's not get completely hung up on one worm. Yes, it's a new one and farmers are talking about it and we need to understand it, but we still have everything else we need to look and discuss.
And I believe it is going to get wetter next week, so I hope it doesn't.
I'll hold you to that.
I hope it doesn't cause too many problems, although I think after 2 months of not a lot of rain, you're probably quite looking forward to a bit, aren't you?
Yes.
Yeah. When you get videos from someone in Wales doing their third cut, it gets a bit painful.
Yeah, we've not had many third cuts. They've just gone topping instead. Yeah.
Listen, John and Will, great to speak to you. Thanks, obviously, for Elanco to make it possible to kind of work through how we sort of help to solve this Haemonchus conundrum. Great to have two such experienced vets in the field on where obviously the disease is more prevalent as well. So I hope this has helped those vets and perhaps even a few farmers who are listening as well to make a bit more sense of it. So thank you so much for coming on the podcast.
Thank you for inviting me.
Cheers. Thank you. Thanks again to Elanco for making this possible. And thank you for listening, and hope to see you on a podcast or a webinar very soon. Take care.